I am honored to give this talk in Islamabad, Pakistan, even though I could not be there in person. I hope that I am still able to communicate some of my ideas through this slideshow. The problem today is that we think that the era of bad hair transplants is over. For example, we think we don't see these Uri type flaps, we don't see these issues with large plugs anymore, but there's so much artistry that is involved with the recipient site creation. And to me, as a hair surgeon, that is one of the most fun things that I can do. So if you look at this gentleman on the left, you see that his hairline still looks unnatural, and he's had absolutely no uh, types of plugs placed, but they are compressed due to bad placement by the staff. The hairline is too straight, the angles are too high, and there's a lack of density. And so this is a single session correction that we have done in my clinic to make this person look more natural. This gentleman here, you can see that the grafts are too large for the hairline. The hairline is not well designed. There's also compression again. The grafts look they don't fit into the site well, and they're also pitted where they go too deep into the hole. So all this is a large part to do with the designer and also the team. And so if the team is bad and the surgeon is great, the results are still poor. Finally, this is an example of a gentleman where the angles are straight up. I call this surprised hair. They're also, again, too straight. There's no density. The hairline is unnatural, does not match the temple area, and this is a correction. For me, the fundamental thing here is to understand the Norwood patterns. And I encourage all the beginner students out there to look at the Norwood patterns because they are the key to understand what defines a natural pattern and what defines an unnatural pattern. We oftentimes just gloss over this photograph or drawing in a textbook and move forward, but without a clear understanding of the Norwood pattern, we really cannot design beautiful hair transplants. And the lingo that hair surgeons use are predicated upon these different sub-regions of the scalp: central forelock, extended forelock, the frontal zone, the lateral humps, the mid-scalp, vertex transition zone. So it's very, very important when we design recipient sites that each area of the scalp is designed differently. For example, the angles in the crown would be different from those made in the mid-scalp and in the frontal region. And this schematic here is probably an easy one to show you the different directions and angles of how hairs grow. And this is something that is from my textbook. This is just showing you that there are no abrupt transitions in the scalp. And what that means is that when you design recipient sites, you should not have a recipient site going forward and the one adjacent to it going all the way sideways. There should be a smooth, slow transition from one angle to the next. And how do you see this in reality? Well, you go and take a look at people's scalps, and you'll see all over the head there are no abrupt transitions on any part of the scalp. Each hair gradually changes to the next. So as you're designing recipient sites, it's very important to remember this key principle. And that involves also the angulation from front to back. So in the front, the biggest mistake is to make these angles too high, as I said earlier, a surprise look. So you want these to be low, and as they go up to the crown, and we're going to be talking about that in a separate lecture, the angles go up very, very high. And then as they go back down in the lower part of the crown into the donor area, they go low again. So all these soft transitions go from side to side and also up and down. In terms of the lingo that we use here, the angle refers to the up and down direction, anterior posteriorly. That's what was shown in the last slide. And then the direction, when we talk about direction, that means how that recipient site goes from left to right. And of course, how the recipient site is made is going to dictate how the grafts are placed and how those grafts will ultimately grow. The tilt is something that is shown in the pink here, is not quite as important, but sometimes there is a slight angulation of the recipient site that is made as well. And this is oftentimes more prevalent in designing female hairlines, but it's an advanced topic that does not necessarily bear importance here. This is a schematic that I created to help communicate to the beginning hair student to understand the different regions of the scalp. And if you think of the head like a box, you can think that the forehead to the mid-scalp transition is going from a vertical to a horizontal plane, and that's just defined as the hairline. What is the hairline? The hairline is just the part where it goes from horizontal to vertical. So that's why you don't want to be doing hairlines on the vertical forehead, because it should not exist there. On the sides, the lateral humps are just defined as the vertical side of the scalp, and as it goes over to the flat horizontal portion, the mid-scalp, that is known as the lateral crease. And similarly, on the back side of the scalp, the vertex transition point is basically the transition from the horizontal to vertical scalp, where the crown, as you can see on the figure on the left, is the vertical portion of the back of the head. So if you think of the head as a box, you can think of the planes of horizontal and verticality, and those are what defines how to design the recipient sites. In general, recipient sites can be designed in three different ways: sagittal, also known as parallel, perpendicular or coronal, and micro punch. In my third volume of my textbook series, I talked a lot about the micro punch, which at one point in my career was very important. But today I only use the micro punch to remove scar tissue, for example, out of the linear scar in the back from a strip procedure, or scars in other places to create better vascularity, etc. But I find that that is not as helpful when I'm trying to dense pack areas, and I feel like it can compromise the blood supply. There's a lot of argument that the perpendicular site, or the lateral slit or coronal site, the one that's pictured in the middle, is the preferred method due to some marketing ideas that the grafts splay wider open so that they create better coverage, and they also don't angle up as much. The grafts don't slide vertically up to create less visual show. In my opinion, both the parallel and perpendicular are both awesome ways to make sites. I oftentimes make some sites parallel, some sites perpendicular. It really depends on what I'm trying to use it for. And I think I'll talk about a little bit of that as I proceed with this presentation. But I think the design in terms of the angle, the direction, the density patterns are far more important rather than choosing a parallel perpendicular. For beginning students, I absolutely advocate the parallel, because perpendicular is very hard to visualize how the direction of hair flows. It also is something that is very hard to place sometimes, because the staff member cannot really figure it out. In the hairline and in the crown, absolutely for me, the parallel is the preferred method. And also when there's a lot of dense hair around it, I prefer the parallel, because I think the perpendicular has a higher likelihood to transect pre-existing hairs, especially previously transplanted hairs, where you don't know exactly the angulation of the hair exiting. So I like to use parallels for a large part of my cases, and I use perpendiculars for larger grafts, 3-hair grafts, to create better visual density, and also to transition, so that when someone's looking at this, the staff could understand what is a 2-hair graft, what is a 3-hair graft, and so these are just tools of design. But to boil it down, to make it very simple for beginning students I would say the first 5 years, I would make all the sites parallel. I would just forget about perpendicular or micropunch things. Again, probably the micropunch only for areas of scar removal. What is fun about design is really to use all these different size brushes, if you will, in other words, recipient sites, and different angles and different patterns and densities. And this is, for those that do rhinoplasty, there is something called a Gunter diagram, where you illustrate all the details of how you've designed your work. Well, this is actually one of my designs that I make for a patient, and it's not for you to memorize what I did, but it's to show you how creative and fun a hair transplant can be. What's very important when you're designing the hairline is that you have all the recipient sites going forward. This is something that is probably the biggest mistake when I teach students and I watch them design hairlines. I watch them splay the sites going side to side. There are several problems with this. When you do this, because the scalp is already in a curved plane, everything moves away from the central forelock, or the central area of the scalp. that makes that area look visually less dense. And the central forelock is a key area to have visual density. So I either have my sights going forward or they go slightly in or converging into the midline so that you can create better visual density in there. So the other mistake I see when people are making recipient sights for the beginner is that because they're working on a curved space, the left and the right sides don't look the same. The left side, because the hand has to go on the left side, it just doesn't look right. So I encourage all of you, if you are a beginner, to as a promotion for my St. Louis course, August 2nd through 4th this year, 2019, I encourage you to come and take it. I make no money on any of the courses or any of my books. They all go to charity. So there's no financial motivation except my passion to teach. So I always say what's so important is not listening to a lecture I give you, but for me to watch your hands design. When I see you in about 5 minutes, I can see if you're doing a beautiful work or not beautiful work and what you need to make some corrections. And as I watch that correction, you can immediately get good feedback and improve things. This is showing you the transition from the hairline into the temple area. Again, what I want you to see is that gradual transition. There's no abrupt transition. Over here, this is a crown that's not quite completed, but you can see that there are no abrupt transitions in the whorl as they go from one area to the next. This is a female hairline. You can see that this is a little more complicated design, but what you're seeing is, again, no abrupt transitions. This is a gentleman that I followed his ghost hairs, and what I mean by ghost hairs are his residual fine vellus wispy hairs that he has left, and I'm just gently curving those in an arc fashion to match what his natural hair is going. So even though I mentioned that all hair should go straight in a gentleman, there are times that that rule can be broken. And this is a great example of one of them where they are actually curving in a clockwise fashion as they go up toward the hairline. And this is probably slightly more advanced for someone beginning doing things. And I also encourage when you're doing something like this, which is a temporal point, that this really should be for someone at least 5 years into his career, his or her career, because the angles have to be so exquisitely flat. If they're slightly angled upwards, it just looks terrible. So I really encourage those that are beginning in the design of the recipient sites not to get anywhere near the temple area because it's just problematic. This is a lady that has had a previous facelift, and as you see here, she's had that whole area removed. When I do facelifts, I do not remove all this hair, but this is just a transplant into that area here. In the past, I would be using 18, 19, and 20 gauge needles, but one thing I did find was that with the larger size needles, sometimes there could be some cyst formation at a month or so. There's usually just a few, but those go away pretty quickly. But since I moved over to using 19 and 18 gauge solid cord needles that are one use for each patient, they really don't allow the epidermis to be trapped underneath the skin, and I found that I virtually have eliminated cysts or anything like that. So this is a very nice transition that I have made. Other types of recipient sites, you can have flat blades, etc., in addition to needles, and this is just a simple chart that maybe you can photograph and take home with you. It just gives you an idea of the different size instruments, how big they are, and how many hairs they accommodate. One lesson, though, is that if you're a beginning surgeon, and that's my passion is to teach beginning surgeons, to be truly careful with making sure that your team is the same level as you, because if you make these really tiny sites like these 21 gauge, 20 gauge sites, and the staff simply cannot place into them, they will bang up the grafts. The grafts won't grow well. They'll be mangled. They'll grow out. Pardon this description like pubic hair, kinky. It won't look right. So you really have to make sure your staff and you are working together to make sure those grafts really fit. Which brings me to the point of testing the graft to site fit after you've made one or two sites. If you start to make 50, 100, 1,000 sites and none of the grafts fit, you're in a serious, difficult situation. You have to either remake the sites or the grafts have to be retrimmed, which is going to potentially compromise viability, lead to a longer procedure, more patient discomfort, all of the above. So I always make 1, 2, or 3 sites. I have my staff test every one and just make sure all the sites fit, make sure the staff is making the exact consistent sizes before going forward and making all the recipient sites. Tumescence is important. The Abbasi formulation of having a very dilute Kenalog can really help mitigate postoperative edema. And there's still, I would say, about 15% of my patients have some disfiguring swelling on the forehead for a few days. It typically dissipates by day 5, but using this Abbasi formulation helps. It also, what I try to do with the sequential tumescence is place enough tumescence underneath the scalp so that as I make my recipient sites over a period of 1 to 2 hours, that fluid is help buffering and protecting the underlying vascular supply. The patient position is so important. When you're designing a hairline, if the patient is a fully supine position, you can easily angle the the recipient sites very low. As you see here, my hand is able to make the sites very, very low, and that's so very important so that the density is there and the results look natural. Conversely, as I mentioned, when I'm making the crown sites, I'm oftentimes standing up. The patient is more sitting upright so that I can actually make my recipient sites higher up. When the patient's too flat, the sites don't look quite right. This is just showing you just how I make some sagittal sites, nothing very profound, but I really want them to be tightly interlocked and consistently going forward, as I mentioned before. This is here just showing you coronal sites, what a coronal site looks like, and it's just exactly perpendicular to what I just showed you. And you can see I'm mixing and matching right behind those sagittal sites some of these coronal sites. And those are just using some needles here. So let's walk you through a design of a hairline. This is I first draw the hairline, obviously preoperatively before I put all the tumescence in and all the lidocaine in so that I can get a very good hairline that's confirmed with the patient. And I begin with my one hair sites. I make a row of one hair sites, and I'm really trying to take that straight line and regularize it to the best of my ability. Now, when some people that are starting out, they don't like to draw that straight line. They draw the straight line, then they make like a snail trail, irregularize that line, then they further irregularize it with the recipient sites. I go ahead and just irregularize it with my recipient sites themselves. So the second pass of one hair sites, I'm making them further irregular. The more irregular I can make it, the better. So sometimes I'll take 3 passes of one hair sites where I'm making these little sentinel hairs and further irregularizing it. The more irregular that I can make these sites, the less straight the hairline will look and the more natural. Then after that, I begin to build the recipient sites behind that with 2 hair sites, and I continue to build that. And you can see that I'm building more of those 2 hair sites along the sides where the temporal transition point is, because that is an area that you don't want large grafts. And this is showing you how I mix some of the lateral slits or coronal or perpendicular sites. Those are all the same terminology for the same idea. And this is a way that my staff can easily determine what are 2 hair sites, what are 3 hair sites. And as I said, oftentimes those 3 hair sites being placed in a perpendicular fashion can create more visual density because the angles don't go up as much. But again, as I also emphasize, that can be an academic thing. And for people that are just starting out, they really should be making parallel sites, no perpendicular sites. So now this is the same thing shown in a photographic fashion. This is the hairline and the hairline transition zone shown with the 2 lines. I usually don't really draw the 2 lines, but I'm just showing it for emphasis here. I'm making my one hair sites. I'm taking those one hair sites, further regularizing it, putting some sentinel hairs. Again, the sentinel hairs are the hairs that are standing out by themselves. Further regularizing it with one hair sites. Then I'm putting the 2 hair sites behind them. These are all interlocked. They're all angled forward. You see that they're not splaying. And then I've made some 3 hair sites behind them in a coronal fashion. My colleague Vance Elliott has mentioned to me the idea of a coastline. I love this concept because what a coastline is, if you look at it from a very far distance, it looks relatively straight, and the further you go down and look at the coastline, the more irregular it looks, and these little jetties and eddies and these little protuberances come out, and that's what a hairline should look. You should fuss about your hairline. This hairline should not be just designed quickly and done. It should be a labor of love. It should be an artistic statement. The recipient side density, these are just general ideas of density. I would honestly say the 15 to 20 is on the very low end, and the high density, you got to be careful because you can easily run out of grafts. So you really want to make sure as you practice recipient side creation, and I love using a melon because you can make sites on this round melon and make sure your sites look good. But also as you're designing this on a melon, you can say, okay, in 50 square centimeters, how many sites can I place into here? Will I place a certain number of recipient sites to fit into that space? And will I run out of sites or run out of grafts? So you've got to practice not just making the right angle, direction, density, but you also have to make sure that that density gradient fits the space. And when you're putting those density allocations, these are just an example of how to make those density gradients. So the central forelock can be an area of greatest importance along the hairline. The hairline and the central forelock in terms of visual importance. The 2 means these are not quite as important. You could probably cheat a little bit, use less density, and then 3 is less important, 4 is less important. And so these are areas that you could use less density. You said, well, why don't you just put all the same density across the whole area? The reason is that the areas that make someone look bald would be toward the central forelock and hairline. The problem, though, is if you put all the density in the front, you're going to have a result that looks unnatural because natural hair loss pattern does not have an incredible thick, dense front and then this wispy backside. So this very delicate balance in terms of recipient side density is so important in the design process, and that comes with experience. And it's, again, I encourage you to be trained by someone and not only watch them do it, but have them critique you making recipient sites on melons, on non-humans, so that you can practice and have feedback. It's so powerful to have that. And again, sorry to plug my St. Louis course again, but when there's that very small, intimate environment of 5 students and 1 faculty, and you can really repeatedly make sites in front of the doctor of a faculty member, it can really help you understand what you're doing right or wrong and make those corrections very quickly. So these are just some patterns. Again, these mean nothing to you except the fact that I'm showing you how creative the process of recipient sites can be. And that's so important when you're making recipient sites, is to have the passion and the desire to deliver excellence in your design work. So I say that a hair transplant is very cerebral, left-handed in terms of calculations, but there's also this beautiful, fun, artistic side to designing as well that I encourage all of you to engage in every time you do a hair transplant procedure. Thank you for your attention.